You may have heard the term SMART objectives or SMART goals many times. SMART is an acronym, meaning the S stands for specific, the M for measurable, the A for attainable, the R for relevant, and the T for time-based. So as we go through the next few minutes here, we'll give some examples of how an objective can be made more SMART and be able to be more specific, more measurable, more attainable, more relevant, and more time-based with just a few changes. So again, what is a SMART objective? You can see on this slide, we've color-coded some of the different letters within SMART. So the S for specific will be red, the M will be green for measurable, and the T will be blue for time-based. And then we're showing you here an example objective. So within the Healthy Eating, Active Living, or HEAL initiative of the Paso del Norte Health Foundation, this is a fairly typical objective that many organizations might be doing something similar. So for today, we're going to use this same objective and we're going to walk through it and discuss the different components of this objective that make it a SMART objective. Instead of having that very simple, straightforward, but hard to measure, hard to know whether you've met that goal or not, we walk through some steps to make that specific objective more SMART. Okay? So again, our example objective is by August 1st, 2019, program staff will implement a new evidence-based health education curriculum for at least 60 youth, 6 to 10 years old, that will increase child self-efficacy related to daily health choices for food and physical activity. All right, so let's talk about what specific means, the S in SMART. So specific is the who, the what, the how, and the why of the SMART objectives. Explanations of this example. If we look at who, you can see in the example above, program staff is highlighted in red. Program staff is part of the who. They are the ones who will be trained in this example. Also in the who would fall youth 6 to 10 years old. So we've now defined who's being trained and who this health education curriculum is for, very specifically. What, in terms of specifics, again, we are implementing not just a program, but a new evidence-based health education curriculum, much more specific. For how are we going to be implementing this new program? Kind of overlaps with the what in this case, by using a new evidence-based health education curriculum. We're explaining how we are implementing it. And then the why, well, our purpose of this whole endeavor is to increase child self-efficacy related to daily healthy choices for food and physical activity. So everything that you see up here in red are additional components, additional words that have been added intentionally to make this objective be a SMART objective in terms of being specific, right? We also have a handout that you can download from our website in the same place, on the same page as where these videos are linked on the Paso del Norte Institute for Healthy Living webpage, and it will run you through some more examples of this. So right now we're talking about this example of the evidence-based health education curriculum. That handout will walk you through some additional examples as well, so you can see this multiple times. So on this slide, we're talking about what makes an objective measurable. Objectives need to be measurable so that you can know whether you've actually accomplished that objective or not. Sometimes we make them so vague that it's really difficult for us to report on them and be able to say whether we did or did not accomplish that thing, whatever our objective was. By making it very measurable, we can easily say, yes, we attained this, or no, we did not. We define measurable in this case as the example of having at least 60 youth who go through this program. And then again, by defining those youth in terms of their age. So not just 60 youth of any ages, but 60 youth from 6 to 10 years old. So using your program records, you can say, yes, we accomplished this goal, or we did not. So achievable and relevant are both a little bit more generalized. So they don't have colors coded to them in this case. When we look at achievable, we need to look at our overall objective. We need to make sure that this objective is challenging us, helping us stretch, but that they're not so much of a stretch that they're not able to be achieved. We have to make sure that they're reasonable. In addition to that, we have to make sure that you as an individual or you as an organization possess the things that you need to be able to achieve that objective. Do you have the right inputs? Do you have the money? Do you have the software? Do you have the location? All of the things that are necessary as inputs. Do you have the knowledge? Do you have the skills? Do you have the abilities? All of those things, when you put them together, help us determine whether a specific objective is achievable or if it's not. Sometimes how long you give yourself to accomplish this goal also is connected to whether it's achievable or not. In some cases, an objective that's achievable in 12 months is not achievable in three months. So being very careful about how you set up your time to make this achievable is also something you can consider here. For our next component, our objectives need to be relevant. So they need to tie into our key responsibilities and align with our broader overall objectives within this specific program or for the organization. We want to make sure that what you are doing, the objectives that you're putting forward, are not things that are so far afield of what your organization is established to do that it becomes problematic and it's reaching outside of your wheelhouse or it's causing scope creep for your organization. So if the purpose of your organization includes health education of youth related to healthy eating and active living, then that connection means that this objective makes sense for you. When your proposal comes in and those objectives are well connected to the purpose and the mission of your organization, those are more likely to receive support. In addition, as is mentioned here, by increasing child self-efficacy, which is a child's self-confidence that they can make these healthy choices, that is relevant to overall health. So if your organization's focus is on improving the overall health of an individual, it would also be relevant, this objective would also be relevant to the work that you do. Relevancy to the HEAL proposal is important when you are writing a HEAL proposal. So anytime you're writing any kind of a proposal, you want the objectives to be, at least the core objectives, to be relevant to that organization and that funding agency as well. So when we go to our last component of the SMART model, we see that it's time-based. So in this case, we want our objectives to be linked to a time frame. Not just any time frame. This time frame should help us have a sense of urgency, but also be likely to be accomplished. Okay? So we want to have this tension, ideally, between our current reality, where we're at now, and the vision of this objective. And we want to get there. We want to make sure that we are creating a deadline that helps focus us and get us moving and helps us to accomplish this goal. So in this case, having our goal set for being achieved by August 1st of 2019, that gives us a time frame to work within, so we understand what we need to do and how quickly we need to get on this so that we can make sure that this objective is reached. So when we bring it all together, we have a week objective example. This is a separate objective, okay? Training project staff and volunteer leaders on this curriculum. So before we can go in and we can actually use this curriculum and provide this health education to the youth that we talked about before, we need to train project staff and volunteer leaders on it so they can use it. So the week version of this objective would be just that simple statement, training project staff and volunteer leaders. when we try and make that weak objective stronger, we want to make it smarter, we make it specific and measurable and achievable and relevant and time-based. So in this case, we're going to say we're within the same organization as the last example. So the achievability and whether this is relevant or not, those both are well done within this objective. It's achievable, it's relevant. In terms of specific, you can see the words that are in red are the things that we've added to make it specific. We already had in the week objective staff and volunteers, but here that's defining our who. What? Well, we're going to have our Eat Well, Be Well curriculum training program. So we have this specific type of curriculum. We're defining which curriculum and that we're providing training on that curriculum to these people. Also, as part of being specific, we're saying we will then have a post-test where we measure participants. So the post-test allows us to be more specific. It's not just we're going to ask participants questions, but we are doing a post-test. When we look at the green for measurable, we can see we're talking about all project staff and volunteer leaders, not just a few, not the ones that are most convenient to reach, but all project staff and volunteers. Again, according to our training records, we can tell, and sign-in sheets even, who was participating in this training. Making it measurable also includes the time frame for how long this curriculum training program will take. In this case, we're defining it as 1 hour. This isn't going to be something that we're repeating every 6 weeks and building on itself and have this be a really long, complex type of training system. It's 1 hour. That's all we're doing. 1 hour. Under measurable, when we start talking about this post-test, we don't want to just have a post-test. We want to have a post-test in which all participants score at least 90% correct answers. So we've defined now what success looks like in terms of measurability. Every one of these leaders will be participating for 1 hour, and everyone will be able to respond at least 90% correct answers to this post-test. And then finally, to make it time-based, in the blue, we're saying by what date this will be happening, by September 15th. And that is SMART goals. So we've talked about this first step. Before you can get into the next steps of action planning, you need to have your objectives made as SMART as you can. This can be a process where you bring in a team of people from your organization and you brainstorm and you work on this together and you figure out how to refine these and make them better and better. It can be a process. So in the next video, we're going to start talking about step 2. So after we have our SMART objectives established, then we get into brainstorming activities.